Good evening. I am Juror Takithia Fennell. I am here to discuss case number 4, um, a case against AU Bright Smiles Dental. Just to disclose in the beginning, I am siding with the plaintiff in this case. To begin, a little bit about the case. Patients at AU Bright Smiles Dental are stating that the medical facility disclosed their medical information on the outside file of their records. This file was tagged with a red sticker that read AIDS. Now, in a medical practice, I do believe that it is necessary to have color coding and just other things to let other physicians and clinicians know, hey, this person um, has this disease, take this precaution, or this person has this, or, etc. But in this case, these patients' medical history, it was out for the world to see, or, anyone that came into the practice, and I feel that is very wrong on um, ethical levels, but, just in law, period. That's why the HIPAA laws were instated. HIPAA states that the appropriate safeguards to protect the privacy and personal health information um, of a patient. Now, that's what HIPAA is for. It is in place to protect patients and set guidelines for uh, healthcare offices and providers and physicians on how they disclose these patients' health information and who can see what and what should be disclosed and where and all these things. There's a guideline, there's laws and rules that need to be followed in order to essentially protect the patient. Um, Now, AU Bright Smiles is claiming that there is nothing wrong with what they did. Disclosing that information is necessary for their clinicians to take proper precautions. Yes, as I stated, I do feel that physicians need to have codes and guidelines and color coordinate things so that they know that, how to handle it. But like I said before, I don't feel like it's okay to put that on the outside of a file and bear this person's personal, their health, what's going on with them, having HIV, AIDS, or, having any sickness like that is already hard. But to have everyone else be able to see it and know your name, and that's horrible. It can ruin lives. It can get out. Today is the age of information. All it takes is a tweet or a random Facebook post or someone to take a picture of it because it's sitting out, um, and that's ruined that person's life. Uh, HIPAA is a big deal. If I say HIPAA a lot, it's because that's mainly what I wanted to focus on, siding with the plaintiff. That's what that law is there for. It's there to keep patients safe. It is set in order to just to protect your healthcare information. That's why, the government deemed it necessary to have a law like HIPAA, especially since now we're in the age where almost every medical record is digital, or it's on a computer, or it's a electronic healthcare file, uh, because it's currently flowing through systems and going to offices and emails and things like that. HIPAA is set in place to protect the patient from having their information shared with someone that's not their physician, that's not treating them, having it put out somewhere where it shouldn't be put. And that's why I'm siding with the plaintiff. HIPAA and just the overall ethics in this case is the reason why I'm siding with the plaintiff. I feel as though it's a violation that this person or these people have been violated. And I always say, like, if she was on the other foot, how would, the doctors feel if their information was put out for the world to see? Or if um, this dentist office had all of its doctors and dentists information put out for the world to see. I just think it's wrong, and I'm siding with the plaintiff because even though the defendant stated that patients couldn't see the files, if it's on the sticker and it says AIDS and it's in red, I'm pretty sure that the patients can see the file and the names of those people that are on those files. So um, yeah, my name is Takithia Fennell, and I am siding with the plaintiff. Thank you.